Hello, my name is Jesus Guzman, currently taking RTE 1804 at Kaiser University, and I chose to do the Calcaneus as my project. Once you call your patient and greet them, you will introduce yourself by telling them your name and letting them know that you will be taking their x-rays. You will communicate with the patient by asking about their reason of visit and if they have any pain in order to not cause any more pain or make them uncomfortable. To verify the patient, you will ask them their date of birth and full name in order to confirm you have the right patient. For example, good morning, John. My name is Jesus and I will be taking your x rays. Just to confirm, you're here just for a chest x ray, right? Okay. Are you in any pain? Can I have your date of birth and full name, please? The calcaneus is the largest tarsal bone that is commonly fractured. 60% of those fractures comes from adults and younger males. Fractures on the calcaneus can also be caused by falling down from a great height, car accidents, and twisting your ankle. To view the calcaneus alongside the talar articulations and the talocalcaneal joint, two projections are performed: the plantar-dorsal axial and the lateral mediolateral projection. The reason why this procedure will be performed will be because the patient has fallen from a great amount of height, received axial loading on the calcaneus during a car accident, not being able to apply weight on the heel, twisting their ankle, and osteoporosis, such as tumors or cysts. For example, a 17-year-old boy who plays soccer twists his ankle and cracks his heel bone by tackling another player and landing on his foot wrong. Before the procedure, you will interact with the patient by verifying their name and date of birth, confirming the right exams, asking if they have any pain, telling them to remove any personal items that can obstruct the anatomy, give them privacy when they remove their clothes or don't have any, explain the procedure, give them instructions on how you want them positioned, and make sure they are comfortable. During the procedure, you will make sure that the instructions you give are clear for the patient to understand. You will watch their behavior to see if they are in any pain and comfortable, and you will make sure that the patient doesn't move when you take the x-rays. After the procedure is done, you will allow the patient to gather their belongings and or get dressed. You will let them know that the results will come in approximately 5 days, and if the patient was under an exam in fluoroscopy, you will let them know what to expect when they get home or later on that day. Some of the symptoms the patient may have will be pain, bruising, swelling, heel deformity, not being able to apply weight on the heel or walk. Here is a picture of a sprained ankle and a deformed calcaneus. The patient will experience pain to chronic pain on their heel whenever they apply pressure to stand or walk, which will cause them to limp. They will have limited motion to move the foot around, and if the heel is deformed, then the patient will not be able to fully support their weight. So, in X-ray, it will help confirm the patient's diagnosis of the fracture, which will demonstrate if the patient has broken their bone or displaced it. In CT, it will illustrate the fracture in more detail, allowing the doctor to have a better view of the heel and be able to make the best choice for treatments. For the plantar dorsal axial projection of the calcaneus, you want to make sure your SID is 40 inches, the cassette size is 8 by 10 inches, and 70 kVp. In this case, since I'm using the IR that is placed under the tabletop, all I need to do is center the calcaneus in the middle and collimate. The patient must be supine and they will have to dorsiflex their foot. The CR will be at the base of the third metatarsal and angled 40 degrees cephalid from long axis of foot. You want to make sure Your CR is also aligned with the IR before you take the image. For lateral medial lateral projection, the technical factors are the same, but the patient will be in a lateral recumbent position with the affected side down and flexing the knee 45 degrees. As you align the CR with the IR, make sure the CR is perpendicular to the IR, about 1 inch inferior to the medial malleolus. Here is an image of the plantar axial. Here is the X-ray image of that projection. Now here is the lateral medial lateral. And this is how it will come out in the X-ray image. Here we have an image that has a few errors. The foot is elongated because the CR is greater than 40 degrees, which causes the talocalcaneal joint to be covered by the fifth metatarsal base, and there is no marker on this image. To correct this image, you will have to add a marker, angle the CR 40 degrees in order to have no distortion of the calcaneal tuberosity, and the joints to be open without superimposition. Here is a list of the few references I had. And that concludes my presentation on the calcaneus.